Good morning, everybody, and thanks so much for joining us here on KXAN Live. I'm Will DuPree. We hope you're having a good Tuesday. During this stream, we're going to tell you a little bit about my conversation that I had yesterday with the White House vaccinations coordinator, Dr. Bechara Choucair. Did an interview with me to talk about the Delta variant and its presence here in Texas and across the U.S. The CDC has recently labeled this particular variant, which originated in India, as a variant of concern. And that means it is more easily transmissible and possibly poses a risk to withstand some of the vaccinations that are available here in the U.S. Now, I will point out, health experts say that the best protection against this and other variants is still our currently available vaccines. They have shown incredible efficacy to fight this particular virus, this strain of the virus, I should say. So we should point that out too. But we also discussed yesterday about the availability of when younger children, those who are younger than 12, may be able to get the COVID-19 vaccine. A lot of families out there may be wondering about that as they look towards the fall and the new school year. So I asked the White House vaccination coordinator about that. Before I show you that conversation, though, I want to give you a sense of where the variants stand here in Texas. The Texas Department of State Health Services shared this particular data. And right now, the most dominant variant here in the state is the Alpha variant, which originated in the United Kingdom. As you see right there, it has resulted in more than 3,000 infections in the state, followed by the Epsilon California variant and then the Gamma one, which originated in Brazil. However, there you can see the Delta variant has only accounted for about more than 24 cases in the state. And that's where I began our questions with the vaccinations coordinator. So here is that conversation that I recorded yesterday with Dr. Bechara Choucair. First, I wanted to ask you about the Delta variant. Texas has only reported 25 cases of COVID-19 caused by the Delta variant at this time. That is a pretty low number, so I'm wondering how much concern there should be for people here about that.
Well, look, we have seen the Delta variant now getting detected across the globe, actually in more than 70 countries, including here in the United States. And we have seen the cases in the United States go up. If you look at late May, only 2.7% of the cases were Delta variant. Early June, less than 2 weeks later, it's 9.3%. So significant increases. We are concerned about the increases in the Delta variant across the country. And we want to make sure we do everything we can to protect ourselves, protect our communities. And that truly starts with people getting vaccinated.
How much risk does the Delta variant pose to those of us who are now fully vaccinated?
Well, what we know about the Delta variant is that if you're fully vaccinated and you've completed both doses of the vaccine, you're fairly well protected. But the fact remains that if you're unvaccinated or if you've gotten just one dose and you skip on the second dose, you remain at risk, irrespective of your age, irrespective of your medical conditions. So we'd want to do everything we can to make sure that those who started the vaccine with one dose get their second dose. Those who are not yet vaccinated start the process so that they can get vaccinated.
Turning now to vaccinations, a lot of families are wondering if their younger children will be able to get the COVID-19 vaccine before the next school year starts. So what's the outlook now for COVID-19 vaccines becoming available for those 12 and younger?
Well, maybe we'll start with 12 and older. We know that millions and millions of adolescents have already gotten vaccinated, and we'd want to make sure we do everything we can for everybody 12 through 15 to getting vaccinated. So a big push here with big call to action. Now for kids younger than 12 years of age, we know there are studies that are going on right now for Pfizer, for Moderna and others, and we're tracking those. Our colleagues at the NIH and the FDA and the CDC will be reviewing those. And once we get the result of those data, the result of those trials, when we start seeing the data, they get evaluated by our scientists at HHS. That's when we will know when we will be able to have vaccines available for younger than 12 years of age, possibly by the end of the year, early 2022.
So is there much hope that it would be available for the start of the next school year for those younger children?
Wait and see.
Okay.
We're going to have to wait and see. I mean, we're going to have to let the FDA does what the FDA does, review the data, analyze the data, and make a scientific-based recommendations. And once they tell us they're ready, we'll all be ready to execute on programs to get people vaccinated who are younger than 12.
While we have you as well, I wanted to talk about the COVID month of action that the White House has put out there. You wanted to join me and talk about that in particular. So I'm wondering how close we are to getting to that point of 70% of adults at least partially vaccinated by the 4th of July. What's the progress right now?
Well, we've made tons and tons of progress, over the last few months. We have more than 175 million people in this country with at least one shot of the vaccine. We have more than 145 million people fully vaccinated. When you look at 40 years of age and older, more than 75% of those folks have gotten at least one dose. So we're making good progress, lots to celebrate. At the same time, we know there are still millions of people who are unvaccinated, and we want to do everything we can to make it as easy as possible for them to get vaccinated. And that's really the reason why the president launched the month of action. It's about expanded hours at pharmacies. It's about pop-up vaccination sites at sports events, NASCAR races. It's about vaccines at beauty shops and barbers. It's about having mayors rolling up their sleeves and getting engaged in door knocking, canvassing, texting. It's about community colleges and universities saying we're going to do everything we can to get our students and our staff vaccinated. It's truly an all hands on deck approach. We're not leaving any stone unturned. We're pulling all the stops to make sure that we get as many people vaccinated by the 4th of July as possible.
What can we personally do to try to help us reach that goal a little bit faster? Because I understand there's been a lot of celebrities and social media influencers involved with this particular campaign, but what about us personally? What can we do?
There's a lot that people can do. And let me just start by saying, people who are fully vaccinated, I would encourage them to take a moment to pick up the phone or have a one-on-one conversation with their neighbor, with their friends, with their relatives who are not yet vaccinated, and share your personal experience with them. We know from research, from surveys, from focus groups, that people trust people they know. And I have no doubt that people who are vaccinated in Austin, in Texas, anywhere across the country, have tons of people who trust them. So having that one-on-one conversation is so critical to making sure that we're getting more and more people vaccinated. And if people want to learn more, they can go and sign up to become a community core volunteer, where you get all the data, you get answers to frequently asked questions, you get tips for things to post on your social media, and you can go to wecandothis.hhs.gov, wecandothis.hhs.gov, and you can sign up to become a community core volunteer member.
Dr. Choucair, is there anything you'd want to add that we didn't get a chance to speak about? I'm sure that's a very broad question because there's lots to discuss right now, but I wanted to leave the floor open for you.
Thank you for everything you do. Let's make sure we get as many people vaccinated. We want to protect people, families, communities, and we want to put this pandemic behind us. And this all starts with vaccination.
All right. Dr. Choucair, thank you again.
Thank you so much.
That was, again, Dr. Bechara Choucair, who is the White House vaccinations coordinator. He spoke to me yesterday, again, about the Delta COVID-19 variant, its presence here in Texas, and the availability, potentially, of the COVID-19 vaccine for children younger than 12. He said that the timeline for that becoming available through an emergency use authorization may be later this year or even early 2022. If you'd like to see more about this interview and the reporting about this, we have it on our website, that's KXAN.com, and on the KXAN News app. So please download that if you've not done so already. Thanks again, everybody, for watching. I'm Will DuPree in the KXAN Live Studio. We'll see you back here at another time. Please take care and stay safe and healthy out.